Welcome, everybody. This is a day of action that is taking place in a number of places around the country with physical actions and this virtual coming together to make change. My name's Elane Heffernan and I am chair of the Disabled Members Committee of the UCU and on the National Executive. And obviously, a lot of our members are facing COVID as an industrial injury now from having to work face to face, and our students are being, well, Larissa will talk about this, but tormented and made ill and exploited throughout this crisis. So just to say very quickly that at the moment we have 4 key steps that we believe are absolutely vital now to COVID zero, which is a full UK-wide lockdown until new cases in the community have reached close to zero, an effective find, test, trace, isolate and support system, which is run locally in the public sector and not by Boris's mates. COVID screening and where necessary quarantine at all ports of entry to the UK, and to guarantee the livelihood of everyone who loses money. There are other things that need to be done and speakers will refer to those. Without any ado, I'm going to hand over to our very first speaker, who is Roger Lewis. I'm really pleased to have someone from Disabled People Against the Cuts here to speak to us. And sorry, I should have said for those who can't see that I'm a woman with shoulder length, blondie grey hair and glasses. Roger's camera will be off throughout speaking. Welcome, Roger.
Roger seems to have dropped out. We might need to move to second.
Okay, the technical problems of 2020 and living online. Our second speaker will now be our first speaker, and I'm really delighted to introduce Larissa Kennedy, who's the president of the National Union of Students, a fantastic campaigning organisation for students and a great ally to my union, the UCU. Larissa.
Thank you so much, Elane. Yeah, I mean, it's a joy and a privilege not only to be president of NUS, but to be an ally to UCU. And I think, you know, when students and staff are working in solidarity, like, we're unstoppable. So hope to see more of that continuing. And yeah, I guess this morning I just wanted to share a little bit about, you know, the ways that students have been, you know, really done dirty throughout this pandemic, the way that that's impacting us, the way that that's obviously impacting on communities as well, and why we really are behind a zero COVID strategy. So, you know, as I said, students have repeatedly been done dirty from, you know, the A-levels fiasco and that being kind of used, the kind of online space being used as an excuse for a classist, racist moderation system that of course was ableist as well. We saw students having to organise and get out on the streets to just bring this government to account and actually force change there. Then, you know, just, you know, not much time later, seeing students repeatedly lied to over the summer about the possibility of face-to-face teaching, about what was actually safely possible in the context that we're in. And for some students, within days of arriving, everything moved online. And so, of course, there's this mass sentiment that students have been exploited for fees and rent. They've been moved across the country, torn away from their support networks, lied to just so that government and universities could collect fees and rent. And then we saw the numerous student lockdowns across the country, during which, you know, vice chancellors and university management saw an opportunity once again to exploit students, where there were extortionate prices, you know, over £200 in some cases just for a week of food. So how is it safe to isolate when people can't even afford to isolate? And then repeatedly being scapegoated and blamed for the spikes in COVID when students were just trying to follow the guidance they've been given. So, you know, we've got to a point where we can no longer trust this government to give guidance that it is actually supporting students to stay safe, supporting us to keep our families and our communities safe. And so we are looking to, you know, work alongside others who are really looking for those crucial solutions that mean that we're actually going to beat this virus, because we're no longer willing to settle for listening to a government that is constantly putting us at risk, that is constantly systematically invisibilizing and erasing the voices of the most marginalized among us. There is this strange and, you know, very pervasive assumption that students and young people are safe throughout this. The voices of those suffering from long COVID, the voices of student parents and carers, the voices of immunocompromised and disabled students, the voices of Black and brown students have been continually and systematically, as I say, invisibilized and erased. And This is because the government sees, you know, many of us as disposable. The human cost of coronavirus has not fallen equally. It's been disabled, been working class, been Black and brown communities, and particularly those who exist at their intersections, being seen as disposable. And we are not willing to let this government put our lives at risk, because it's not them and their friends who are at risk, it's our lives at risk. And, you know, as well as bearing the brunt of this government who sees many of us as disposable, in many ways, students are also bearing the brunt of an education system that's rotting at its core, an education system where you can have fat cat vice chancellors and university management sitting in their ivory towers, taking home pay packets of hundreds of thousands of pounds and making decisions about us without us, telling us what is safe for us, telling us we need to stand by more windows, telling us we need to open more doors. And that's just, you know, that is not safe. These circumstances that are putting us in are just not safe. This government is working off the basis, they're creating policy off the basis of this, you know, false education system that they experienced decades ago, where, you know, maybe they worked alongside study if they wanted to, if, you know, they wanted a few extra pounds or whatever. But we know now that over half of students have to work just to make ends meet. It's not an option, it's a must. And so those students, you know, have been, again, systematically erased from all forms of recourse to public funds. They're not allowed to get the kind of supplement for isolation payments if they're on low income. They have no access to other benefit opportunities. They have no access to support when they're just trying to isolate, when they're just trying to keep themselves and their community safe. So we're seeing here that students are falling through the net time and time again, being seen as, you know, you're fine, you're gonna just go out there, keep on like normal, everything's fine, when we're living through a global pandemic. And it is really exhausting to see this government seeing us as disposable, seeing us through this lens of their own experiences, and fundamentally putting students, staff and communities at risk. And so we really do want to see a zero COVID strategy, not just for us and not just to keep us safe, but also recognising that we stand in solidarity with workers who have been forced out into work without the proper support, without the proper funding that they need to stay safe. We need to stand in solidarity with all those who are continually, you know, put at risk by this government. And, you know, we need a grassroots mass movement that is capable of, you know, setting the record straight on this and really bringing justice for those who truly, truly deserve it. And so I think I'm going to leave my opening remarks there and just thank you so much to Zero COVID for the work that you're doing in bringing to light the needs and wants of the community and folks at the grassroots who really deserve better and will demand better from this government. So thank you.
Thank you, Larissa, and solidarity to the students. Yeah. Okay, so our next speaker is Roger. So Roger Lewis from Disabled People Against the Cuts, who will not have his camera on. I'm delighted to welcome you, Roger, to speak.
Thank you, Elane, and apologies, my call just dropped off just when you were doing your introduction, but pleased to be reconnected again. Thanks to Zero COVID for inviting us, and on behalf of Disabled People Against Cuts, DPAC, that's the term I'll be using for short. Solidarity on behalf of Disabled People Against Cuts. This is a particularly important event for us today. 2 days ago, we were celebrating International Day of Disabled People, but it's also the 10th anniversary of the establishment of Disabled People Against Cuts, DPAC. So it's a double celebration and commemoration for us today. A duality is something that is going to be a theme of what I'm going to talk about. When we talk about the International Day of Disabled People, this is a celebration of our movement and our history. The self-organisation of disabled people that's got a long history, and we follow on with the commemoration and the forwarding of that agenda. But it's also a commemoration because it's those that we've lost along the way, and that's over the last 100 years and many, many more. But that's relevant today, which is what I'll come on to talking about. Disabled People Against Cuts was set up 10 years ago, 2010. It was at the Tory Party conference, anti-trade union, the trade union demonstration against the Tory government at that time in Birmingham. People, I'm sure, were there. You remember it. It was pouring with rain all day. That's where DPAC got established. A group of disabled people got together, and that's where I first got involved in it. That was to set up because we saw what was coming. 2 years previously, we'd seen the financial collapse globally through the huge financial collapse that happened, and it was clear that we were going to have to pay the price for that. And they started by dividing us. And they thought, well, disabled people, you're the easiest target. You're the ones you're not going to fight back. You're not going to stand up. We can have a go. So that was the beginning of the Welfare Reform Act. It was the beginning of the attack on welfare benefits, the establishment of the work capability assessments, and everything that's gone on from that. That's what DPAC formed to organise about. But the one thing that, if you want to say one word that typifies DPAC, is the word solidarity. And there's two reasons for that. One, that we saw that we needed to organise ourselves as disabled people as a pan-impairment organisation involving as many people across all different impairments. So that includes people with physical impairments, with sensory impairments, with neurodiverse conditions, people who experience mental distress, and it's not an ending list. Also see that it's not just us. That we saw that the attack on us was going to be the start, but it was going to be an attack on other people as well. And to disabled people, we're also Black. We're also LGBT plus. We're workers. We're people out of work. We are people of all faiths and none. And we've also been involved in terms of the climate change situation, because there's no change for equal rights on a planet that's dying. So solidarity we see in that broader context, and that's been the strength for me in my involvement with DPAC. It's been extraordinary 10 years in working in that with all of the people that we've done. People will know us for our work around welfare reform, for our direct actions, the roadblocks, the huge public events, but they only involve a small number of people. And that's the danger of it in a way. But what we're also doing behind scenes, and we're ahead of the curve in some way, because we also realise the use and the importance and the power potentially of using social media for those people who are disabled, who can't travel easily, who can't get to the demonstrations, for whom that's not necessarily the accessible way of protesting. So we use Facebook, we use Twitter, the Twitter storms, the use of social media to at the same time as our public demonstrations, to involve huge numbers of people. And that's been an incredible, powerful tool in relation to building up and joining in what we're doing, and linking our fight to other groups where the government wants to divide us. One simple example I use was it's the obvious one: disabled people going into job centres. And that's where they were facing the reality of coming out of the job centre, having been told, you've been sanctioned, no more benefits. We had people who wanted, and you can understand it, they wanted us to do the protest, go into job centres. We had people who wanted to go in and superglue themselves to the desks, to the telephones. People literally who were there and set fire to themselves. And I'm not joking on that. Yeah, we had a hard argument. We said, no, we need to look at where the real problem starts, and that's with the government and the government program. And we looked and we worked with the PCS union, who are the union that works with people in job centres. 40% of job centre workers are also on benefits because they're part-time workers. They were trying to divide them there. Half the workers were unionised in the PCS, well organised, and had some sort of support, but they were playing against each other on that. And we argued, and we had to risk our own reputation on that. We won that argument. And that's the way we've worked throughout. So that's been hugely important. But then comes COVID. And where does COVID start? What we had was a government that started with herd immunity. This is a dream for the eugenicists movement. And we've got a government which is stuffed in the cabinet with eugenicists. There's a history to this. And I'll take you back there because it starts back in the 1930s. Adolf Hitler and the T4 program that he introduced that led to the death in Nazi Germany of 250,000 disabled people plus. That's the ones we know about, far larger number, but it didn't start there. It didn't start there. That movement had already been existing in America. In the Eugenics Institute that was headed by people like Rockefeller and Andrew Carnegie, the huge capitalist productions, you saw disabled people as a brake on the production of profit. Hitler used that and he lifted it lock, stock and barrel and started that. That's where the T4 program started. Those people were not Nazis, but they opened the door and they led through to that. That's when we look at today, what's happening with what the government's done with herd immunity, but also what it's done with the care home system, with the use of draconian and widespread do not resuscitate notices, particularly aimed at people with learning disabilities and people with autism, totally ignoring the safeguards that have been put in place that have led to the deaths. 2/3 of the people that have died from COVID are disabled people, and it intersects with the with all of those from BME backgrounds, not because there's a genetic inheritance, because it's socio-economic. And we need to link those things together. That's what we're seeing again today, that possibility. Boris Johnson, Donald Trump, they're not Nazis, but the same as it was with Carnegie and with Rockefeller, it opens the door to the right unless we do what we're here to do today, which is to begin to unite ourselves and stop them dividing us, whether it's by disability, whether it's by a race, whether it's by faith, whether it's by any of the things that they seek to do. And that's why this meeting today is so important, and we're so proud to be a part of it. That's the history of DPAC over the last 10 years. We are fighting for ourselves. We know what the challenges are that we need to fight back against, but we know, and we knew from the outset, we can't win that on our own, because we need to continue to unite together, to fight together. We're facing an urgency. 20 years ago, we could have said, yeah, it's time. Climate change doesn't give us that anymore. We've got 10 years, we've got 15 years, we've got 20 years to turn the system around. We're working with a system that is broken. That's where I'll go back to where we started, that financial crisis of 2008. That's not a one-off. It's a capitalist system that's broken. When people say we want to get back to the normal was broken. We don't want to get back to the normal. We've got to get back to something that's new, a new way of organising, not just here, not just in the industrialist advanced countries, but globally. Otherwise, you know, we're in a fight for survival. That sounds desperate, but there's the opportunity, there's the hope, because we are the 99%. And we know the answer is, if 5% of us, 10% of us stand up and we all shout in the same direction, we can wash the rest of that 1% out of our lives and out of the control that they're doing. And we can start to build a better world, a world that's there for us, that's designed for people, not for profit. So that's the message from DPAC. We're going to stay fighting. We've been there 10 years. We'll fight and we'll fight. And we're not going to go, when your back's against the wall, you've got no choice. But we will continue to fight with you. And we thank you for this opportunity. And I'm really looking forward to hearing all the other involvement from everyone here today. Elane, thank you very much.
Sorry, thank you. And we look forward to coming together in protests again in the future. Our next speaker, before we go to some of the physical protests that are taking place, is Professor Yaneer Bar-Yam, who's from endcoronavirus.org and who very kindly has got up at ridiculous o'clock in America to talk to us today. So over to you, Yaneer.
Thank you. I have two stories to tell, two parts of what I want to say. The first is scientific. I'm a scientist and a teacher, and I've been working on this pandemic since January. after working on pandemics for the last 15 years. And the message that I have from science is that there is a lot of confusion about what we can do. And I'm very happy to help people understand what it is that is going on with the disease and with what we can do to stop the disease. And the story is that the disease is a very severe disease. We know that. And that it rapidly spreads in the population. And that's very clear. The third thing, which is super important, is that we can stop it. And that's what zero COVID is about. It's the realization that we can stop the disease and get rid of it. We didn't have to have it arrive. We could have stopped it early. We could have stopped it at any time. What we need is to recognize that we can do it and to take the essential actions. And the essential actions, we know to take strong action to avoid being near each other for a short amount of time, not a long time, but for a short amount of time of weeks. If we are not in contact with each other, the disease dies without being able to transmit between people. So if we have to be near each other, we have to take precautions, wearing masks, and anything that we can do to avoid being near each other helps. And then if people get sick, we have to find them. We have to identify who is sick and isolate them very carefully. Also protect them from being near their families. We have to provide quarantines. And all of that has to be supported for their health needs and for their financial needs, so that everyone will be safe, that they will feel safe and be safe, and that everyone else will be safe from catching the disease. And then we also have to be careful about bringing the disease from place to place. We need safe borders so that we don't bring the disease back in to the country. So we need quarantines when people come in, but we also within the country, we need to start by setting up multiple zones and preventing the disease from going zone to zone. And then we can actually solve the problem faster because we can get to zero in each zone and start opening up while we wait for other zones to get to zero. And that makes it much faster and much easier. And that's really important to help us get there. And of course, we have to tell people how to protect themselves. We have to make sure there are safe services, essential services for them, and so that people are protected when they have to work. And that requires a lot of careful attention. And of course, where people live in shared housing, whether it's prisons or whether it's schools or whether it's anything else where there are long-term facilities, we have to make sure it's especially safe because, as we know, once it gets in, it spreads very rapidly. And there are and we have to, of course, make sure that care and the hospitals have the ability to provide care for those who are sick. So there are a few things that we have to do, but if we do them, we can get rid of the disease. We can get to zero COVID, and we can restart living normally. And we know that this is the case because the science says so, the analysis says so, but also the experience says so. There are multiple countries that have been able to achieve this, including early responders, Taiwan, but also countries that showed recently that it's possible, even when there's an outbreak, to suppress it and get to zero. And that, of course, includes Australia, where there are multiple states where they've been able to get to zero. And aside from perhaps a few embers, they're all celebrating Christmas as normal with family and friends because they're at zero. And it's really important to understand that this can be done in rich countries, in poor countries, in island countries, in countries that are part of the mainland, in every type of country that we know, including countries that are authoritarian and countries that are democratic. That's not the issue. The issue is making the decision and understanding the few steps that we need to get there. And it doesn't even take that long. So that's the first story, the story about science. And in that story about science, there are some misconceptions that we need to talk about. The misconception that we can't do it, the misconception that economics and getting rid of the disease are in opposition. They're not. If we get rid of the disease and we open normally, the economy will be in much better shape. We've been at this for 10 months, and surely it's not as good as getting rid of the disease and being free of it and being able to do normal social activities and economic activities. That's the scientific story. Yeah, there's the second story. And the second story makes my blood boil. And that's the story about a society that doesn't care. It's a society that has convinced itself that selfishness is the way to personal advancement, that it's okay to take from others because that's the way you advance yourself. It's a zero-sum game society where indeed the people in power, whether they say they're on the right or on the left or from one party or on the other, they're all, and we know this, and this is a statement that is not new, they're co-opted by the forces that are controlling the forces of power. And we know this, and I don't have to tell you this. And the statement that we know is that the society has changed its understanding of how you advance yourself from caring about other people and the fact that by caring about each other, each one is cared for, to a society that is focused on individual advancement and individual ability to progress at the expense of others. And this is the real reason that we see the inability to respond to the pandemic. The societies that have been successful are not the societies that I told them the science. They care about the science, but they care about the science because they care about each other. And they care about the fact that people won't get sick. So the question that they ask themselves, the first question they ask themselves is, how do we prevent people from getting sick? And if we ask that question, then the answer is obvious. And we look to the science to help us answer that question, which were the answers that I gave you before. That was the earlier story. The problem is in other places, and this was said before, that people have decided that any form of caring has to be by definition something that takes from them, because they base their understanding of the world on the zero-sum idea that something that gives to someone else is something that takes from them. And the fact that that's not true about the pandemic, it just isn't, is hard for them to understand. It's just hard, not because it's hard to think about it, but because their baseline assumption is that this is a zero-sum world. And in the world that they live, everyone gets sick and everyone suffers because each one is selfish and for themselves. Whereas in the world that we want to be in, people care about each other and we all advance and can benefit from the fact that we share and we care and we can defeat the disease, and we can go to celebrations where we express our caring for each other, and we don't have to suffer the consequences. And it was mentioned earlier that students, and the focus of attention was students in colleges, but the people that are in positions of power are there because they have learned how to express their caring as if they care, and not because they really care. And this is, you know, we hear about the fact that they care about students in schools, right? It's good for students to be in schools. And the idea there is that they're not affected by the disease, they don't transmit. And of course, that's not true. The science says they are affected, they do get sick, they are harmed. But it is obvious, even if that were true, it's obvious that the people who say that don't care because, of course, the parents and the grandparents and the teachers are surely affected. And there is no doubt that caring about students has to include caring about their parents and about their grandparents and about the teachers. So we have to figure out a way to overcome this problem. And the way to overcome it is by starting with caring for each other, and through the caring for each other to understand that we can get rid of this disease and to get rid of it. And it is going to be by our action, all of our action, that we're going to be successful. Thank you.
Thank you, Yaneer, and I'm sorry for interrupting in the middle. Okay, so we are now going to go to the Manchester protests. Just give it a second for the person to be unmuted.
Hello, my name is Emma Runswick. I'm a doctor in the Northwest, and I'm here in Manchester today at the Zero COVID rally, where we are campaigning for a zero COVID strategy, one that prioritises both public health and the economy in the way that other countries have in New Zealand, in Taiwan, in Vietnam and other places. Thank you everybody who's joining us online as well. I understand that some of you are clinically vulnerable or in tighter lockdown areas, so can't come out to rallies that are happening here in Manchester, in Leeds, in London and many other places in the country. Thank you for joining, despite all the difficulties that we have at the moment. We've heard from lots of speakers today talking about what we need to reduce the death toll in this country and to prevent further pandemics happening, as well as to reduce the effect on the economy and to reduce transmission in this country. We've talked about support for isolation, which is still woefully lacking. We've talked about how in the Northwest, where we've had pilots for lots of testing, particularly in Liverpool, that lots of people have been denied the support that they require to self-isolate financially and also practically. If you don't have the money to order a £40 delivery shopping, you will go shopping. If you don't have the money to not go to work, you will go to work. We know that in some parts of Liverpool, the uptake for testing has been as low as 4% because people cannot afford to know the results. Those kinds of things are really crucial, an obvious public health measure in these times of crisis. In the NHS, we know that lockdowns have only really come when the NHS has been close to overwhelmed. That strategy is not a strategy that prioritises our lives. It's a strategy that prioritises the agenda of the government, and particularly their reputation. We need to know that they've made a choice to allow the deaths of thousands, tens of thousands of people in a way that other countries have made other choices. We could make other choices, and this is the campaign that we're working on today, and hopefully into the future. We've heard a little bit from some Labour MPs and some SNP MPs. We know we could do better. We know we have to target those people, those decision makers, to change the direction that this country is going in, both in England, but also in Scotland, Wales and Northern Ireland. Thank you.
Thank you, Emma, and solidarity. Okay, we're moving over to, I can see on my screen, the Underground that I haven't been to for very many months now. We're moving over to the London rally.
Hello everybody around Britain, to other demonstrations. We're here today in London as part of the Zero COVID campaign day of action to say that the best Christmas present available would be a zero COVID strategy, not a return to the failed three-tier system. We are also here outside the office of Serco to protest at this private company being awarded a contract for test and trace when there are excellent and experienced public health teams available in the NHS and in local authorities. Serco has seen its profits surge by over a third since giving the contract, yet it's a failure. Their call handlers reach a lower proportion of contacts of people who have tested positive than local public health counterparts. And the Tories are waving the Union Jack for being the first country to approve a vaccine, but deaths are approaching 70,000. Despite the scientific evidence, lockdown measures are being lifted over Christmas and the New Year, leading to a justified fear that infection rates will rise again in January. A vaccine is indeed welcome, but will take months for the population to receive it. In the meantime, we need a zero COVID strategy to eliminate the virus. That means the strategy using physical distancing, masks and hygiene. It means an effective publicly provided test, trace and isolate system, not the failure of the privatized Serco company. Workplaces should be closed unless certified COVID safe. and all workers that are furloughed or isolating should receive full pay. This strategy is in stark contrast with that of the right wing in politics, who argue that we have to live with the virus, protect the vulnerable, and get the economy going. We did not live with cholera or the plague or polio, so why should we live with this virus? And this means what they want is putting private profits ahead of people's lives. Instead, we need a zero COVID strategy to protect people, not the profits of private companies like Serco. Good luck to everybody. Let's continue the fight.
Thanks, Fred. We are now moving to Newcastle protest.
Protect public health, not private wealth. 20 billion down the
So we need to mute London, who are doing a good job of making noise. First, shall we have move early to the question and answer session? There was a question in the chat, which was, let me just move up. There are still people out there who are contrarian, who believe COVID is a state plot to control us. There are a minority of scientists who are also contrarian. How to counter them? So, sorry, after that question, if anyone would like to answer it, if not, we'll go straight to Dr. David Strain, who is a medical doctor who's worked on a COVID ward and who also has been a COVID patient as well. So, yeah, we'll come back to the question. David, would you like to speak now?
Yes, thank you very much. And actually, that's probably a question that I should start taking. So my name's David Strain. As you've just heard, I'm a physician. I've been a consultant on a COVID ward. I'm also a very active member of the British Medical Association and part of one of the major universities in the UK. But I do have to stress from the outset, everything I'm saying now is on my personal opinion, based on the extensive review that we've done of the literature, and actually have spent in the last 6 months sat watching people die of COVID. It's a horrible disease. I have seen more deaths in the last 6 months than I saw in the first 6 years of my career. It doesn't kill quickly, it kills slowly, and it kills in this horrendous manner, which means that you can't be with your relatives. It is highly infectious. And people are dying with, well, basically with a stranger there to hold their hands. And don't get me wrong, every single person who's died on my ward has died with one of our nurses or a healthcare assistant or one of the doctors, a member of their team by their bed. No one has been lonely while they've died, but they've not died with their loved ones. And I keep stressing that over and over again. This is happening. This is very, very real. We have the average length of stay with COVID is running at around 14 days, as opposed to standard pneumonia, it's 4 to 5 days. With influenza, it's about 6 days. And that means people are occupying hospital beds for at least twice, if not 3 times longer than usual. That means many other services have needed to close down. That means we are facing a follow-on tragedy, where we've had people who haven't had access to the diabetes care or the heart attack care or the cancer care because the beds have been full of people with this disease. And you've already heard, this disease is spread from person to person. The only way it gets around is from people meeting other people. It isn't in the air conditioning, it's not in the vents, it's not anywhere else apart from direct droplet transmission, possibly aerosol, but predominantly just us being too close to the people around us. And that's all it's going to take to get rid of this. Yes, we've had amazing news that there is a vaccine on the way. And I'm fully supportive of that. And I know that there's been doubters, there's been people suggesting that we've rushed it. That's not true. This vaccine is based actually on years and years of work. And it just so happens that the stars have aligned and the technology has come to pass at the same time that we needed it due to COVID. But realistically, it's at least 4, if not 5 or 6 months before that vaccine or whatever other vaccines come through offer the nation the protection that it needs. In that time, our children are not being educated, our people are not being adequately employed. We are facing the financial meltdown because we couldn't stay away from each other for just that little bit longer. Since I started talking about the need to eliminate COVID, to get to a near elimination status where there are very, very few cases. I want to emphasize this. We are talking here about zero COVID, but what that actually means is we want to get to a stage where every single case of COVID can be identified quickly. We can get to a point where we can use our public health physicians, and we have one of the best public health services in the world that is currently being sidelined in the placement for private contractors. We want our public health physicians to be able to identify every case early. And it's great having this test and trace system that they've recently rolled out in Liverpool, but that only works if we can test, trace, isolate, and support. Because without the isolation and support, some of the poorest in the community, some of the people that we should be looking out for, either won't be prepared to go for the test for fear that they won't be able to feed their families, or they get the test results and they don't know what to do with it. So we need to get to a stage where we can withdraw ourselves from the people around us. Doesn't have to be complete withdrawal. If you can form social exclusive bubbles and you can hand on heart know everybody that the person you're engaging with is speaking to, then that's fine. So if you want to meet with one other household, then just stick to that one other household, and you know that the 6 of you between 2 households will never engage with other people, then none of the 6 of you are going to catch it and you're not going to spread it amongst each other. But the rubbish ideas of let's 6 people meet from any household and they come together and then they can go apart and one person can then spread it to the next and spread it to the next and spread it to the next. That's how this virus transmits itself. This virus only gets around from person to person contact. I have seen way too many people die unnecessarily. Unless we get on top of this virus, unless we get on top of the spread of this virus, whether that be through your isolation, whether that be through making sure every single workplace is COVID secure. Because once it is COVID secure, great, we can get the economy going again. But we need to get on board and get on top of this. And unless the government starts listening to us, people like us, the people who genuinely want the economy moving, we want to work, we want to be back in our usual places of work, we want to be providing the education for the children, we want to be providing the manufacturing that's going to see this country through. But the only way we can do that is once we beat this virus. Going back to that question, and I think that question there, that actually does highlight a lot of the issues that we're facing. There is a small minority of people, but they are a very, very vocal minority of people. I would urge any one of those to come, sit with our team and spend 2 minutes, just 2 minutes, talking to a nurse who's had to sit with an elderly patient dying without their family next to them. Spend 2 minutes talking to the family of that person who died, explaining what it feels like to know that you couldn't be there and hold the hand of your relative. Ask them to do that. Anyone is happy to do that, have that conversation, and still claims that COVID is some state plot. It's just not going to happen. Please, everybody out there, stay safe, maintain your distance, make sure you're in a COVID environment. This virus only spreads from person to person. Support the near elimination of this virus so that we can go back to a normal life. Thank you.
Thank you so much. So we know that we shouldn't be travelling up and down the country. It appears the internet's decided not to do that today as well. And also that local protests have to be really fairly small, because it isn't only people who are clinically extremely vulnerable, which is a word we don't really like in the disabled community, who are very at risk. You know, many of us will not use public transport and will go anywhere we can walk and so on at the moment to protect those workers. Graham is from Edinburgh, so I don't know, Graham, if you would like to say something.
Yeah, this is Graham up in Edinburgh. We've I'll
our demonstration has come to a stop. As you can see, it's pouring with rain, but it was well attended, and we took a lot of videos which we're hoping will be used by possibly by Scottish television. The protest was held outside of the UK government buildings, which is established here, because we want to make the point that it's really the UK government that is kind of being primarily responsible for the COVID-19 disaster. Anyway, very best wishes and solidarity from Dublin, Scotland. Cheers.
Thanks, Graham, and stay safe up there. It's an area, of quite difficulty. I should say that all the protests that take place are risk assessed quite carefully and involve people that can get there without putting a strain on public transport and so on. I hope that we have Andy, who is in Preston, to just give us a little report. Andy, are you ready?
Yes. So we've just got here in Preston and just kind of setting up and things like that. So Lancashire's been fairly hard hit in terms of COVID in the second wave, particularly sort of peaking around October before the lockdown. We were part of the kind of negotiations with the national government around how we were going to go into tier 3. We have in our county, we have a Tory council, so they didn't like what was happening, but I think essentially political loyalty kind of followed through, and so we've had our sort of tier 3 restrictions, and obviously part of the national lockdown, and it does cause kind of serious hardship for people around people not being able to work, and lots of our kind of service sector economy closing down, and manufacturing jobs and things like that being lost, none of which is really legislated for or worked for in terms of the lockdown and the government having a plan to kind of deal with it. At the same time, as an economy here in Lancashire, lots of our workers work in the public sector, so we've been able to maintain. They've been able to maintain at least some wages and things like that, but it's become much more reliant on that as an economy during lockdown. What we've seen is people in the public sector going to work being particularly hard hit by actually catching the virus. So we've obviously got the school problems here, which I'll talk about in a minute, but even just in terms of social care and things like that. The schools are obviously one of the big issues, and we have tried since tier 3 to get them to go onto rotas in Lancashire, so that we have less school kids in at any particular time. We've built a bit of a coalition around that with local politicians and things, but obviously we've come up against that brick wall of the government, and we've got a sort of lukewarm Lancashire County Council that don't really want to go against government. The lockdown did have some effect, okay? So in Preston, we had a ward where there were more than 900 cases per 100,000 people, which is like staggering, really. That has come down over the sort of national lockdown. Some places now are down to 300. Lots of places that kind of peaked around the 400 mark are down to just below 200. So it has had an effect. That effect kind of stopped though this week with the opening up. So most places, the fall has kind of it stopped. The rate of cases has stopped falling this week. If you look at each Friday's data dump, and so we're already at a stage now where everywhere is opening up for Christmas, and we're looking at seeing a resurgence of the virus again in like a third wave in January, really. So we need something that gives people the confidence that we can get through the next period while we wait for the vaccine without people having to contract the virus, without having to go to places like schools that are very infectious environments without things put in place. So a sort of campaign like Zero COVID kind of answers both of those questions. So just in our conversations that we've had while we're setting up today, the idea of one, taking the virus seriously and trying to drive it down is important, but two, the fact that we should be putting proper measures in place to allow people to do that, allow people to quarantine and allow people to isolate. So yeah, that's us from Preston. Thank you
Thanks,
very much.
Andy. And I don't know who the other
Oh,
speaker.
no, Janet's here. Yeah, if you.
Welcome. And I notice you're from People's Assembly, which is a massive campaigning organisation that is also working on the zero COVID, and we're working together on those things. So that's brilliant. I guess I want to just say very, very quickly that sometimes it can feel very difficult trying to build zero COVID when lots of people out there think we are part of it, think that's something to do with the conspiracy theorists and those marches going on in London. But actually, I think it's beginning to really kind of get hold of people, and these little events are watched by more people than come. They're noticed in the towns, and it's a slow cycle in the trade unions because we're just bureaucratic and have months between meetings sometimes. So bear with us our slowness, but this is developing. So don't ever lose heart. It's important what we're doing, and every life saved matters.